Hello, everyone. My name is Stephanie Houle. I'm a clinical psychologist and researcher in Canada, and I've been doing research on moral injury and military and veteran mental health for over a decade now. And I'm pleased to be able to present this topic for you today. The objective of my presentation is to provide an overview of the concept of moral injury as it relates to mental health, specifically in military personnel and veterans, and to provide some insights on how mental health clinicians and systems might approach dealing with this type of suffering. This presentation is mostly intended for clinicians and those working in mental health, but those with an interest in moral injury will also be able to take away key points of understanding about the topic. The presentation will be in two parts. First, I'll provide an overview of moral injury, what it is, and its relationship to mental health. And in the second part, I'll describe some principles of moral healing and how clinicians and mental health providers can manage this form of distress in their practice. I'd also like to mention that due to the nature of the topic, some of the events and other content that I describe may be difficult for some people. And so please keep that in mind and remember to take care of yourselves as needed and pause the video if that's what you need. So to begin in defining what moral injury is, first we need a common understanding of morals. Morals are commonly agreed upon values and duties that serve as the foundation for how societies and individuals within a given society behave. And thus they serve to commonly define what is good and what is right versus what is wrong in a given society. In the history of war and conflict, it is, of course, no surprise that violations of a given society's norms for what is right and what is good lead to moral consequences. And such consequences have long been described in literature and art as being impactful and as causing suffering. However, it was in 1994 only that the term moral injury, as it is now used in the field of psychiatry and clinical psychology, was coined in a book by Dr. Jonathan Shea, a psychiatrist who worked extensively with Vietnam veterans in the United States. And he talked about moral injury as an undoing of character, as the damage done to one's virtues, which are the building blocks of one's identity. Damage caused by a betrayal of what is right by someone in a position of authority that occurs in a high stakes situation, such as war and combat. Since then, definitions of moral injury in the military mental health literature have continued to proliferate. And today, the most commonly used definition of moral injury is the lasting psychological, biological, spiritual, behavioral, and social impact of perpetrating, failing to prevent, or bearing witness to acts that deeply transgress people's moral beliefs and expectations. And with regards to mental health, moral injury is most often conceptualized as a stressor-related problem, meaning that similar to our understanding of trauma and post-traumatic stress disorder, it's understood that exposure to an event of a certain magnitude, in this case, violations that are of significant moral potency, can lead to sustained impacts in some individuals. And similar to PTSD, post-traumatic stress disorder, many people who are exposed to morally significant moral stressors are likely to recover, to integrate that experience, and to move on with their lives without significant impacts on their functioning. However, a subset of people may express moral injury as a particular pattern of suffering, which does impact their daily lives. And that's what we'll be talking about mostly today. So I'd like to note as well that conceptually, again, these events and their impacts, we can imagine them as occurring along a spectrum. So a spectrum of frequency and of impact. So on one end of the spectrum, we can think about moral frustration. So these could be experiences that, maybe someone didn't give you the right change at the store, and that leaves you kind of morally frustrated, like, oh, they didn't do the right thing. These are events that might happen commonly in our daily life. You see litter on the ground, people didn't pick up their trash, things like that, that might lead to feeling morally frustrated, but typically they don't go on to have a sustained impact on the individual. Moving down the spectrum, you can think of things like moral distress as a little bit more severe than moral frustration. So being morally distressed by learning that you've been lied to by a partner or a friend, that could potentially have more ramifications for your understanding of yourself in that relationship. So it might lead to, you being preoccupied by that event a little bit more. And when we talk about moral injury, then that's when we're talking about events and impacts that are a bit more extreme on the end of the spectrum. So events like those that occur in war that are really not common and of high magnitude. And we'll talk about what some of those events look like in just a moment. But this is where we use the term moral injury, tends to be on that end of the spectrum where we imagine that an individual has been significantly impacted by the moral stressor, such that they are perhaps unable to have good functioning in their relationships, in their work life, in their sense of self. So these types of what we call potentially morally injurious experiences, or I'll also use the term PMIE, these types of experiences generally fall into two categories: those involving one's own personal responsibility and those involving the responsibility of others. So these, in the context of war and conflict, these can be things where in terms of personal responsibility, where I did something, I was disproportionately violent towards a detainee, for example, or I did an action that harmed civilians or civilian life, killing or injuring the enemy, failing to prevent harm to others. And in the category of responsibility to others, this could be witnessing disproportionate violence, witnessing harming of civilians and civilian lives, feeling betrayed by trusted others or trusted systems. And this diagram essentially shows, kind of adds on to that idea of personal responsibility and responsibility of others by mentioning how these events can happen. So events can happen either by commission. So I take an action that I deem to be morally wrong. So an action that is against my own beliefs. Or it can be by omission. So I fail to do something that would have been in line with my beliefs. So, for example, I witness someone causing harm to somebody else and I do not intervene. And that is something that I judge as being, that failure to prevent harm would be something that I deem to be against my moral values. And then also in terms of others' actions. So I can witness other people act in ways that are against my beliefs or fail to act in ways that are against my beliefs. And not only witnessing, but I can also be personally impacted by people's actions or inactions that I deem to be morally wrong. So I could experience harm through the actions of other people. And that can also be considered a potentially morally injurious event due to the responsibility of others to act morally. And these types of events can occur in a number of ways. So these can be direct or indirect involvement in, or witnessing acts that violate moral beliefs, like I mentioned. The events can be expected or unexpected. So in the context of war, for example, it could be expected that I, as a soldier, have to kill as part of my role as a soldier. So I have to kill in combat. I can expect to do that. It doesn't mean that it's not potentially morally injurious, because it goes against that moral belief of do not kill. It could also be unexpected, something that happens that you did not anticipate. Like I mentioned, it can include acts of both commission and omission. And in terms of the time at which the violation is perceived to be a moral transgression, it could be perceived at the time of the event. So being faced with atrocities, things like mass graves, that's something that could hit you in the moment as being morally wrong. Or it could also be in retrospect that a person comes to understand an action or an inaction as morally transgressive. So could have been following orders in the moment, and then later when I'm home with my family, I start to question my actions or question the orders that I was following, and that can also be morally injurious. So some additional examples can include threatened harm to self or others as a result of being directed to undertake tasks for which a person was not properly resourced or prepared, sexual assault by a military peer in which there's a betrayal of trust from that brother or sister in arms can also be perceived as potentially morally injurious. And this is data from the Canadian and US context, where we see that these types of events are actually very, very common in the context of military operations and deployments. So in Canada and the United States, data from nationally representative samples of military members and veterans show that exposure to these types of events are common. The first statistic comes from a survey conducted in 2002. So this is conflicts in which Canada was involved before we entered the conflict in Afghanistan. So these are operations like peacekeeping, response to the genocide in Rwanda and the Balkans, various operations in Africa and the Middle East, where we saw that 49% of those exposed to combat saw atrocities and massacres. After in the post-Afghanistan era, so this is 2013 data, up to 65% of those that were deployed reported exposure to potentially morally injurious events, like seeing ill and injured women and children that they were unable to assist, or feeling somewhat responsible for the death of an allied soldier. These surveys didn't, and in the United States, about 40% of combat veterans endorse some kind of PMIEs. And due to the nature of the fact that moral injury wasn't well measured until recently, these don't directly assess moral injury or exposure to potentially morally injurious events, but these types of events that we imagine are potentially morally injurious, such as witnessing atrocities. I'll just note as well that these experiences do happen in other populations. So in the police, for example, 10 to 25% of people report killing or seriously injuring someone in the line of duty. People who work in child protection, child welfare, 92% of them report exposure to these types of events. And in healthcare workers, especially during the pandemic, we also see about half of individuals who in different countries who report these types of experiences. So in the context of war and conflict, then, how do potentially morally injurious events occur? So this slide shows results of an early qualitative study that was conducted among male US veterans having served in operations mostly in Iraq and Afghanistan. And they identified 4 categories of factors that could contribute to potentially morally injurious events. So organizational, environmental, psychological, and cultural or relational factors. And as we can see here, in the context of operations, military operations, organizational factors could be things like inaccurate intelligence, environmental factors, being in an environment where there's persistent chaos and the need to make split-second decisions. Psychological factors could be things like grief, experiencing grief over loss, combat losses, emotional detachment from others, fear and helplessness, a desire to return home. And cultural or relational factors could be things like lack of trust or perceived incompetence of the people that you're working with, uneasy alliances with civilians and collaborators. So these are the types of factors that might set the stage for potentially morally injurious events to occur. I just want to note briefly that the study of moral injury falls within a broader ongoing trend towards categorizing stressors, especially in the military context, with increasing recognition that exposure to different types of events might lead to different consequences. Yes. So I'll give you some time. Please pause the video and review this in more detail if it interests you. And I recommend looking at this paper by Litz in 2018. I'll provide references at the end. So again, this whole idea that there are different types of moral transgressions, why does that matter? Isn't a moral transgression, are they not all the same once your morals are violated? Well, it would seem, like I mentioned, that exposure to different types of events seem to lead to different consequences. So again, the research on this is really new. But what it's starting to show is that witnessing others' wrongful actions and betrayal events are more commonly endorsed than events where I would perceive myself as committing or in an act of commission or omission, having a moral transgression. And we see that self transgression, so again, transgressing my own values through my action or inaction, may prompt stronger guilt than those involving others' responsibility. Traumatic loss and witnessing the aftermath of violence may provoke stronger sense of sadness than other events. Anger tends to correlate both with self-based and other-based events. Betrayal tends to be most strongly associated with secondary traumatic stress and experiences like burnout. Feeling responsible for the death of an ally and an inability to respond in a threatening situations were strong predictors of moral injury among different types of stressful deployment experiences. So even within the types and experiences of potentially morally injurious events, there are likely to be those that are more impactful than others. And self-based transgressions are more strongly associated with impairment among healthcare workers. So, how does one then go from being exposed to these types of events to developing moral injury as a psychosocial problem? Well, much in the same way that PTSD is conceptualized as a disorder of non recovery, meaning that while most people recover from a traumatic event naturalistically, some people experience more sustained problems. And moral injury can be similarly conceptualized in that it can be understood to be, as shown in this figure, the expanded consequences or suffering stemming from costly or unworkable attempts to manage, control, or cope with the experience of moral pain. Moral pain being that natural human reaction to a potentially morally injurious event. That is, it's something that any reasonable person is likely to experience in the aftermath of a potentially morally injurious event. And I'll mention as well that there are cases where there are individuals who are distressed at their lack of a moral reaction to certain events. And that also can be understood to be a form of moral distress or moral injury. So again, you go from exposure to intense, strong moral stressor, a normal reaction of moral pain, and what we call moral injury is, again, getting kind of stuck in that. And that stuckness leads to functional impairment. And so the pattern of suffering that has come to characterize moral injury now has a few core features. Intense moral emotions. So that is emotions that are interpersonal in nature, meaning that they invoke the relationship that one has with oneself in a social context and with others. So things like guilt, shame, disgust, and anger. So, for example, anger arises from a sense of perceived injustice about some situation. That's kind of the moral and social nature of the emotion. Inner conflict or a sense of loss relating to one's identity, spirituality, or sense of meaning. Loss of trust in oneself, in others, in institutions, or transcendent beings or powers for those that have such beliefs. Other features that have also been proposed to be a part of moral injury include sadness, hopelessness, regret, a feeling of betrayal, a low self-worth, lack of self-concern, not taking care of oneself, not taking care of others, rumination. And I'll give an example of what this rumination looks like. Typically, it's kind of going back, reliving the event. How could I have done something differently? And real preoccupation with the outcome of the event. and social problems. So just to bring this to life a little bit, I'll give you some quotes from some qualitative research that I did with Canadian Armed Forces veterans who were describing their experiences and impacts of potentially morally injurious events. This one person says, "If I tell my wife I love her, it's because I think she wants to hear it. I don't know. It's almost like not an out of body, but just an emptiness." So again, that sense of being disconnected from oneself and from others as a consequence of moral injury. This person says, like, just why it happened, how could I have avoided it? Was there another solution that could have happened? If I could go back in time, how would I have done it differently? New things come to my mind all the time. So it just triggers me back. So that's an example of that type of rumination that I mentioned, of trying to kind of mentally undo or understand the event and oneself in relation to the event. So turning now to the clinical relevance of moral injury. Some of the most robust findings on moral injury to date, again, recognizing that this is a relatively new field of research. So these findings tend to show that exposure to potentially morally injurious events and the core features of moral injury that I described earlier are associated with problems like PTSD and depression most consistently. Those are the two conditions that have been researched most heavily. However, there are also associations that have been demonstrated with other psychiatric problems, such as generalized anxiety disorder, panic disorder, and social anxiety as well as complex post-traumatic stress disorder. And one of the most robust findings to date, and most concerningly, of course, is that there are consistent and strong associations that are demonstrated between exposure to potentially morally injurious events, moral injury, and suicidality. And hypotheses for why this is because the experiences that appear to be core to moral injury, such as guilt and shame, loss of connection, loss of spirituality, kind of overlap with the interpersonal theory of suicide, so that which has kind of the core features of perceiving oneself as a burden, of thwarted belongingness, so not belonging to a community due to that sense of putting one apart. Due to my moral actions, I no longer fit in that society. As I mentioned earlier, morals being kind of the foundation in which societal rules kind of function. So feeling as if one is apart from that, I don't belong anymore due to what I've done, for example. And of course, these are risk factors for suicide. And this is one of the main reasons why we really need to pay attention to this form of distress, because of this strong link with suicidality. Other constructs that are clinically relevant and that have been shown to be associated with moral injury are difficulties in interpersonal functioning, as I mentioned, quality of life. And there's also some research to show that childhood emotional abuse is also associated with the experience of moral injury in response to potentially morally injurious events. We'll talk a little bit more about that after. In terms of risk factors, so who might be at a greater risk of experiencing moral injury as a clinically significant difficulty? Again, this research is really new, but what we do know so far from different contexts is that in healthcare workers, people who are women, younger, nurses compared with physicians, and those who work more hours or those who have less experience may be at a greater risk of experiencing moral injury in response to potentially morally injurious events. In military personnel and veterans, among those who've been deployed, because potentially morally injurious events can happen in the military context outside of deployment, outside of combat. So those are things like experiencing military sexual trauma, for example. So among deployed individuals, rank experiencing military sexual trauma, child maltreatment in one's history, and stressful deployment experiences or traumatic experiences are shown to be associated with moral injury. And among individuals that have not been deployed, experiencing military-related or civilian sexual trauma, as well as one's rank, usually lower rank, greater risk for these types of problems. And so the question of how moral injury relates to PTSD is currently a topic of a lot of debate. And while, of course, trauma itself is a much wider concept than just PTSD, conceptually speaking, there's some important differences between moral injury and PTSD that we should understand. So, for example, while both are stressor related problems, the nature of the events are different. So, with a moral transgression being the prime stressor for moral injury, and physical threat, sexual violence, or witnessing the aftermath of violence as being the core event for PTSD. And of course, moral transgressions can occur in the context of a life threatening event, but it's not necessary for us to say that someone might have experienced moral injury. Many veterans describe situations such as witnessing extreme poverty as being potentially morally injurious, for example, and that's not one in which, there was actual threat of harm to oneself or one's sexual integrity, but it could be potentially morally injurious. Some preliminary research also suggests that symptoms of PTSD can be differentiated from core features of moral injury. So, for example, hyperarousal, memory problems, flashbacks, these may be more related to PTSD, whereas anhedonia and the moral emotions, as being accorded the distress, might be more associated with moral injury. And this is just a kind of, again, breakdown, which brings the comparison towards not just moral injury and PTSD, but depression as well, since that's another condition that's also been studied quite heavily with regards to moral injury, quite heavily relative to how new it is as a concept. So you can visit this and review it as well. But those kind of core features of depression, that sadness, low self-worth, that sense of anger, as being overlapping with moral injury. So understandably, moral injury is understudied in the Ukrainian context. However, studies are beginning to emerge. So this first set of research was from 2020, so before the full-scale Russian invasion into Ukraine. This researcher interviewed 15 combat-exposed Ukrainian men veterans who took part in anti-terrorist operation zone. And participants describe moral pain as a shared experience, as an inherent trait that bonded Ukrainian men. One participant described how soul pain could be something that created a sense of loss, but if overcome, could be a transformative feature, providing a sense of belonging to society and stoking a sense of will that they saw as central to Ukrainian identity. That shared sense of betrayal, of an ongoing history of historical betrayal by a former brother nation of Russia, is something that is also present in the narratives of these people and as being a feature of the type of moral injury that might be experienced in Ukraine. So as these individuals said, our pain is different. It's deeper inside. Our pain is because we constantly throughout history have to prove to someone that we are not worse. That is what differentiates us from everyone else. This other participant said, pain is the state of your soul. It does not allow you to live and function normally and feel like you are a full person, that some part of you is ripped out. There's also been some early research on moral injury among Ukrainian civilians. So Zaskina and colleagues conducted surveys as part of their project on the narratives of war. And they found that 66% of a sample of 1,249 Ukrainian civilians reported endorsing significant moral injury. So this is something, understandably, that is being experienced in the Ukrainian context today. I'll just mention that this taking a ecological understanding of moral injury can also be helpful. And so this bioecological model draws on Brump and Brenner's work in developmental psychology that proposes that human development takes part through interactions between people, objects, environments, and symbols over time. And so we can understand, it's helpful to understand moral injury as being not just an event, but event that happens to an individual who is in relationship with other people, their military unit, for example, who is within an organization of the military, who is in a societal context. And then within that, there are spiritual and cultural processes that also take place within the individual, between the individual and their community, for example. And so all of these levels and layers of trying to piece together the experience of moral injury are really important in understanding how an individual as well as a community might be experiencing these problems. What are the social, spiritual, religious traditions, for example, that are common, that dictate the moral rules that may have been violated by the event, for example? So to illustrate further the concept of moral injury, I'd just like to share some of the recent research that I've been a part of on the nature and impacts of encountering children in military occupational environments. So just to give some context to this work, there are 1 in 6 children globally that are living in conflict zones, and there's an increasing recruitment and use of children in armed conflict. And encounters with children are likely to may have mental health implications for military personnel who hold deeply ingrained individual cultural or religious understandings of children as being innocent. And encounters with children might exact consequences like moral injury. However, there's been little research on this. We just imagined that this might be the case. And so we conducted research. We did in-depth interviews with 16 Canadian Armed Forces veterans, all of whom were men, most of whom were married and had children, and most of them had had multiple deployments to locations like Eastern Europe, Bosnia, Central Asia, Afghanistan, and Israel, and Africa, places like Sierra Leone, Djibouti, Darfur, and South Sudan. And this is the collection of themes that we were able to identify in this study. And while I won't have time to review them all in detail, I just wanted to share some examples with you again to kind of bring to life some of what we've been talking about. So first, personal experiences and context of the veteran or military member appear to be an important feature of the experience of moral injury. So for example, the impacts of encountering children were particularly apparent for those who were parents in the study. Another participant shared that I was abused as a kid. It just brought back a lot of hurtful memories, noting that the experience of witnessing abuse of children in the conflict environment brought back memories of abuse from his own childhood, and that this might have been contributed to that experience being particularly impactful. Understanding features of how a person understands their history, who they are, their social roles, therefore, is really important in conceptualizing how they experience moral injury, and thus can also point to avenues for helping them heal from moral injury. We also saw in this study existential impacts of encounters with children that make salient the moral nature of these impacts. So, for example, people said, I went from being a protector to being the anti-bully to being a destroyer of worlds, and it was soul defeating. Another participant says, children are born innocent, children involved in conflict. Witnessing children involved in conflict ruins your faith in a lot of things. In terms of psychological consequences, we also see a core emotion of anger presenting as a psychological reaction. So this person says, absolutely mind-bending rage at the thought that someone was putting children directly at risk. People also talked about negative social impacts. So, for example, experiencing difficulties tolerating the behavior of their own children. And some also expressed positive impacts. For example, being appreciative of their own children after experiencing this. So, for example, this person says, I'm much more appreciative of my own family and the chance that my kids to have a better life. I won't go through this in too much detail. The second phase of the project is where we did participatory action research workshops, where we worked with researchers, health professionals, and veterans together to engage in a process to define research questions and define action areas that can be understood to better mitigate and support morally injurious impacts of encounters with children. This is something that is currently under peer review, but some initial findings include that, again, kind of those contextual elements, a lack of preparation, a lack of training, a lack of clarity regarding how to manage encounters with children in conflict zones, a lack of debriefing after the encounters may be a risk factor for moral injury, and that perhaps there are additional training efforts that need to be made to better prepare people for these types of situations. Although I recognize that that's not always possible, especially in the current context in Ukraine. And of course, it's important to educate clinicians who will be receiving patients with these types of difficulties about the realities of war. What's it like on the ground? Military culture and moral injury, so that they have a context in which they can try to understand people's experiences. So I'll pause here now, and we'll be returning to part two. I'll be returning in part two, where I'll talk about the practical strategies for how to manage moral injury in the context of mental health.